Hello and welcome. Today we're shedding light on a rare but serious eye infection called Acanthamoeba Keratitis. It's a condition that can threaten vision and requires prompt attention. Join us as we delve into its causes, symptoms, treatment, and prevention. Acanthamoeba keratitis, or AK, is primarily caused by a microscopic amoeba called Acanthamoeba. These amoebae are commonly found in soil, dust, tap water, and even swimming pools. Infection usually occurs when these amoeba come into contact with the cornea, the clear front surface of the eye. Contact lens wearers, particularly those who don't properly disinfect or store their lenses, are at a significantly higher risk. Other risk factors include trauma to the cornea, exposure to contaminated water, and a weakened immune system. Now, let's understand how Acanthamoeba actually damages the eye. Once the amoeba invades the cornea, it begins to feed on corneal tissue, causing inflammation and ulceration. The amoeba can exist in two forms: a hardy cest stage, which is resistant to many disinfectants, and a more vulnerable trophozoite stage, which is actively feeding and multiplying. The amoeba secrete enzymes that break down the corneal tissue, leading to progressive damage. This process triggers a strong inflammatory response, further exacerbating the symptoms and potentially leading to scarring and vision loss. Acanthamoeba keratitis is relatively rare, but its impact is significant. While the exact incidence varies, it is more common in developed countries, often associated with contact lens use. Studies have shown that contact lens wearers have a much higher risk of developing AK compared to non-wearers. It's crucial to remember that while rare, AK can affect anyone who comes into contact with contaminated water or soil, regardless of contact lens use. The signs and symptoms of Acanthamoeba keratitis can be quite debilitating. Early symptoms may include severe eye pain, redness, blurred vision, sensitivity to light, and a feeling of something being in the eye. As the infection progresses, the pain intensifies and may not respond to typical pain relievers. A ring-shaped corneal ulcer may develop, and the eye may become increasingly inflamed and watery. These symptoms are often mistaken for other eye infections, which can delay diagnosis and treatment, making the condition even harder to manage. Diagnosing Acanthamoeba keratitis requires a thorough eye examination and specific laboratory tests. An ophthalmologist will examine the cornea using a slit lamp microscope to look for characteristic signs of infection. Corneal scrapings or biopsies are then taken to identify the Acanthamoeba organisms. These samples are cultured to grow the amoeba and confirm their presence. Confocal microscopy, a non-invasive imaging technique, can also be used to visualize the amoeba in the cornea. Early and accurate diagnosis is crucial for effective treatment. While Acanthamoeba keratitis doesn't have distinct classifications or types in the same way some diseases do, it's often categorized based on the severity and extent of corneal involvement. Some cases may involve superficial infection, while others penetrate deeper into the corneal tissue, causing more severe damage. The location and pattern of the corneal ulcer, such as the presence of a ring infiltrate, can also influence treatment strategies. Treatment for Acanthamoeba keratitis is often long and challenging. It typically involves a combination of prescription eye drops, including antiseptic agents like polyhexamethylene biguanide (PHMB) and propamidine isethanate. These medications aim to kill the amoebae. In some cases, oral antifungal medications may also be prescribed. Debridement, a procedure to remove infected corneal tissue, may be necessary. In severe cases, a corneal transplant, also known as penetrating keratoplasty, may be required to restore vision. Treatment can last for months or even years, and close monitoring by an ophthalmologist is essential. Prevention is the best defense against Acanthamoeba keratitis. If you wear contact lenses, follow your eye doctor's instructions carefully. Always wash and dry your hands thoroughly before handling your lenses. Use only recommended disinfecting solutions and never use tap water to rinse or store your lenses. Clean your lens case regularly and replace it every few months. Avoid wearing contact lenses while swimming, showering, or using hot tubs. If you experience any eye irritation or discomfort, remove your lenses immediately and consult an eye doctor. The prognosis for Acanthamoeba keratitis varies depending on the severity of the infection and the timeliness of treatment. Early diagnosis and treatment significantly improve the chances of successful recovery. However, even with treatment, some patients may experience permanent vision loss, scarring, or the need for a corneal transplant. Recent research has focused on developing new and more effective treatments for AK, including novel antimicrobial agents and improved diagnostic techniques. Nanoparticle-based drug delivery systems are also being explored to enhance the penetration of medications into the cornea. While AK remains a serious condition, ongoing research offers hope for improved outcomes in the future.